Good evening, Sorrows of the Camden Alumni Chapter of Delta Sigma Theta Sorority Incorporated. I just want to say thank you for the opportunity to speak to you again this year for World AIDS Day. I pray that the information that I share with you, you in turn will share it with others, and together we can continue to educate and inform our community. So let's get started. World AIDS Day 2020. I am Patrice Robinson from Sandhills Medical Foundation Incorporated. We have 7 sites, and I'll share more of that with you later. World AIDS Day, the purpose. World AIDS Day takes place December 1st each year. It's an opportunity for people to gather, to unite in the fight against HIV and AIDS, to show support for people living with HIV, and to honor those who have died from AIDS-related complications. World AIDS Day dates back to 1988. We have observed this day, December 1st, for 32 years in hopes to raise awareness, fight prejudice, improve education, raise money, and encourage all to know their status by getting tested. 2020 World AIDS Day theme, ending the HIV epidemic, resilience and impact. This year, the theme focused on global commitment to continuously deliver quality, people-centered HIV prevention and treatment services for impact. The theme also speaks to strengthening the capacity and resilience of the community, and to help systems address HIV prevention through this global pandemic. COVID-19 has definitely changed the way we operate. Sandhills Medical Foundation went from seeing clients face-to-face to providing service via telehealth. Our practice provides primary care services as well as infectious disease. Patients now has to be assessed, and then we have to make the decision whether to see them face-to-face or via telehealth. Our practice also provides drive-through COVID testing. This pandemic has definitely made us resilient for sure, but we still strive to provide impactful medical care in what is now our new normal. So this year, when I was looking over information of what I wanted to share, I thought about how in the HIV arena, we use a lot of acronyms. So I wanted to share some HIV terminology with you. Let's talk about these terms because they are very important when it comes to HIV and AIDS. Viral load, that is the amount of HIV in the body. You only know the amount that's in your body. This is only determined by getting labs drawn. The lower the amount, the better. The goal for individuals living with HIV is to get a viral load less than 20. Less than 20 means undetectable. And undetectable means that you have decreased the chance of passing the virus to your partner. Undetectable equals untransmittable. And that is one of the campaigns that the Center for Disease Control have been putting out there for the last few years. If you ever see something that says U equals U, that's what it stands for. Undetectable equals untransmittable. Next, we have CD4 count. Well, CD4, like I like to call it, good cells in your body. They are the white blood cells that are in your body to help fight infections. The higher the cell count, the better, because you have more cells working on your behalf. Next, we have ART, which stands for antiretroviral therapy. These medications treat HIV. They can't cure it, but if taken as prescribed, it's been proven that you will live a longer and healthier life. HIV stands for human deficiency virus. It's the virus that weakens the immune system. When HIV attacks the body, it becomes harder, to fight off germs, infections, and other diseases. AIDS stands for Acquired Immunodeficiency Syndrome. It's the most advanced stage of HIV infection. An individual gets an AIDS diagnosis when their CD4 counts drops below 200. Now, if a person's CD4 counts drops below 200, but they start back taking their medicine as prescribed, and the CD4 count can go back up, which is great, but they still would have the AIDS diagnosis. Next, we have PrEP, which is pre-exposure prophylaxis, or PrEP. It's an HIV prevention strategy in which HIV negative people take a pill once a day before coming in contact with someone that's HIV positive. This right here helps reduce the risk. So say I am negative, but my partner is positive. By taking PrEP, it reduces the chance of me becoming positive. Then we have PEP, which is post-exposure prophylaxis. Another prevention strategy taken after you come in contact with someone that is HIV positive. But here's the thing, PEP must be taken within 72 hours after exposure. HOPWA, that stands for Housing Opportunities for People Living with HIV and AIDS. This is a special funding program to assist individuals living with HIV and AIDS on rent and utility assistance. The last acronym is MSM, which stands for Men Who Have Sex with Men. This is the highest risk factor in the HIV/AIDS arena. Men having sex with men, data has proven time and time again, this increases transmission. So I gave you the terminology to give you some background on the words or terms that we use in this arena. So now let's talk about some statistical facts. According to DHEC and CDC, approximately 1.2 million people in the United States are living with HIV today. African Americans are impacted most with this infection in the United States and also in South Carolina. African Americans in South Carolina comprise of 28% of the state's total population, yet 68% of the total people living with HIV in South Carolina are African Americans. Of the cases with identified risk factors, men who have sex with men was the highest at 53%, while heterosexual relationships followed at 31%. As of December 31st, 2018, there are over 20,000 people in South Carolina living with or have been diagnosed with HIV infections. Between 2017 and 2018, 1,546 people were newly diagnosed in South Carolina. Of the newly diagnosed individuals, 68% of them were African Americans, 25% were white, and 5% were Hispanic. Those are definitely some numbers to ponder on. Our community is greatly impacted with this virus. So let's look at this. It states that about 14% of the people in the United States do not know their status and need to be tested. 1 in 7 people living with HIV are unaware of their infection. So just imagine being in a room with a group of people. You have a table of 7 sitting over here, a table of 7 sitting over here, table of 7 in the back of the room. Out of each group, 1 in 7, one person out of that group of 7 do not know their status. So you hear these statistics and you wonder, well, what's the plan? How can we address it? How are they addressing it? Like, what are they doing to help? Well, there's a campaign called Ending the HIV Epidemic, a Plan for America. This plan's goal is to reduce 75% of new infections by 2025 and reduce at least 90% of infections by 2030. I'm like, okay, so that's the plan. We state the goal. This is what we want to do. So how are we going to reach that goal? Well, we're planning to reach the goal by focusing on 4 key strategies that together will help end the HIV epidemic in the United States. The plan is to diagnose, treat, prevent, and respond. Diagnose all people with HIV as early as possible. That's why it's so important to do community testing, so important to do outreach. It's so important to, when you go to your doctor, to ask them, okay, screen me for HIV. It is so important. As soon as you are diagnosed, then you can be treated. Treat the infection rapidly so that the virus can be suppressed. The goal is to suppress the virus, and that will prevent it from being spread. The next step is to prevent. Prevent new HIV transmission by using proven interventions. Proven interventions are things like PrEP and PEP, using a condom. If you are a drug user, there are programs out there that gives out clean needles to keep you from reusing old needles. Though that's prevention. And then respond. Respond quickly to potential HIV outbreaks. You see where they're going? If we diagnose it, if we treat it, we prevent it, we can respond. All of this working together can end the HIV epidemic. That's the plan for America. It can happen. We can reduce new infections by 75%. We can reduce new infections by 90%. But we all have to work together. With this, so that's the America's plan, right? So then the plan was sent out. Then each state had to decide, well, then what are we going to do to address the issue in our area? How can we? Because what works in New York may not work in South Carolina. What works in South Carolina may not work in California. So this is South Carolina's plan. South Carolina came up with this thing called Data to Care. It's a public health strategy aimed to use all the HIV data that was collected to identify HIV diagnosed individuals, the ones that are not in care, and the plan is to link them to care. And this will help support the plan for America. So with the HIV surveillance data, what they did was look at all the agencies in all the counties of South Carolina. And a team was put together to work on identifying individuals that are diagnosed and not in care, and do whatever they can to link those individuals to care. Data to Care, recently changed their name to Targeting Re-engagement in Care Efficiency, short for TREACE. And I know what you're thinking. Nope, it is not named after me, but that is my nickname, TREACE. So here it goes. What Data to Care did was created a map. This map of all the counties in South Carolina. They were able to identify all the people that are diagnosed with HIV and that are not in care. It was determined through their research that there are about 6,000 people in South Carolina that's not in care. And I've heard the commercials on the Big DM several times advertising about it. So you may have heard it as well. But this map, and just to name some areas, we got Pickens County, about 50 people out of care. Spartanburg County, about 212. Charleston County, 722. But I just want to put some emphasis on the counties that we serve, which is Chesterfield County is about 50 people out of care. Kershaw County is about 50 people out of care. And Sumter County is about 184 people out of care. And when I look at the whole thick of things, these numbers seem low. Like, okay, we can get out there and we can find these people. But what scares me is how 50 can multiply real easy, how 184 can multiply real easy. Because these people are not in care, which means they're not on medication, which means what if they're in a relationship and they're having unprotected sex? Or they are drug users and they're sharing needles with others. All I see and all I hear is the HIV just being passed on, passed on, passed on. So that's why it is so important to do outreach initiatives. It's so important to do HIV testing. It is so important to talk to your doctor about HIV screening. And also, one way Sand Hills Medical Foundation has helped with this Plan for America and with South Carolina initiative, one way we've helped is starting our new initiative. Look at the screen. Our new initiative. We got these flyers going around the office. I made sure every doctor, nurse practitioner, and PA received them, even the nurses. It says, clinicians, don't forget to screen for HIV and hepatitis. What we did at Sand Hills Medical Foundation was we made HIV and Hep C screening as a standard of care. So instead of, if you're a patient of Sand Hills Medical Foundation, and when you come in to do your annual blood work, for your diabetes screenings, for your hepatitis C screenings and all of those, we included HIV screening and Hep C screening along with it. We made it inclusive. Instead of making it a standalone thing where you have to ask about it all the time, no, we made it inclusive. So when the doctor said, okay, it's time for your annual labs, HIV and Hep C is a part of it because it should be a standard of care. And a standard of care is definitely another way of how we can prevent the HIV from passing, and also can help us identify new HIV cases. I have been been the program director of this initiative since July of this year. And we test at all of our sites. And with this new initiative, we have been able to identify new positives in areas where people were shocked. To be honest, when we test individuals in like Sumter County, where they look like me, like, oh yeah, we got a new positive. It's like, oh, okay. It's like, it's normal. But when we started this initiative and all the providers started screening at all 7 of our sites, and we started getting positives in other counties that looked different from me, they were shocked. And I just had a meeting and I shared HIV is everywhere. It doesn't matter what color. As long as you are sexually active, you are at risk. Whether you're black, white, or Hispanic. Having unprotected sex, having sex puts you at risk. That's why it's important that we all get tested. So back to South Carolina's plan. That was my little spiel. But back to South Carolina's plan. Their overall plan is pretty much link and re-engage people to care. Get them to be seen as soon as they're diagnosed. So if someone is diagnosed today, the plan is to have them in front of a doctor at least 2 days later. Because sometime, or what has happened in the past, was people were diagnosed, but their appointment was not until a month later. After that, out of sight, out of mind, people, I don't know what made them just not go to their appointments. But I guess they was like, you know what, it's too long. Just forget about it. I'm going to move on. But anyway, the whole thing, the next one is to make sure they are diagnosed. Once they're diagnosed, they're in care, making sure they see the doctor. And when they see the doctor, get on medication, suppress the virus. When the virus is suppressed, less transmission. Transmission is decreased. And that's how we all can work together to end the epidemic. How can you help? How can others help? Don't be afraid to talk about HIV, AIDS. Don't be afraid to talk about having sex. Don't be afraid to talk about it. It is okay. This is normal. Let's talk about it. Let's talk about it with your family, your children, your church member. I don't care. Let's talk about it. Use condoms if you're going to have sex. Get tested at least once a year. But if you live a risky lifestyle, meaning if you have multiple partners, then you should get tested at least every 3 months. Know your status, but also know your partner's status. Hold the person that you're intimate with responsible for y'all health as well. You just don't go get tested, and then he don't get tested or she don't get tested. We all need to get tested. Don't inject drugs. Be informed. Just be informed. The more information you know, the better you can make informed decisions. Also, talk to your doctor about PrEP and PEP. Those are 2 proven prevention strategies. And you all know this. This is just a refresher. Ways to get HIV. Sexual intercourse without a condom, blood or semen, vaginal fluids, breastfeeding, the mother can pass it to her babies, needle sharing. Also, I just needed to highlight this all the time. Ways you cannot get HIV. Yeah, people still think this, but ways you cannot get HIV. Living together, eating together, using the same utensils, shaking hands, hugging, mosquito bites, kissing, sharing the same bathroom, touching the same surface, walking behind each other. You cannot get HIV that way. Is there a cure? No, there's no cure. But remember I talked about ART earlier, ART medications are used to treat HIV. So individuals living with the virus can live a longer and healthier life. HIV medication reduces the risk of spreading the virus to others. My purpose is simple. I do this because I want to educate my people, one presentation at a time. Knowledge is power. Knowledge is power if you use it. We get the information, we must use the information. So we all can stop HIV together. Let's end the epidemic by raising awareness, fight prejudice, improve education, get tested, and again, know your status. I would like for you all to do this again this year. Use your social media handles to spread the word. Hashtag know your status. Hashtag rock the ribbon. Hashtag get tested. Hashtag World AIDS Day 2020. Hashtag helping my community. Hashtag resilience and impact. Hashtag ending the HIV epidemic. And this one is my absolute favorite. Hashtag spread the word, not the virus. And do not forget, Sand Hills Medical Foundation, we have 7 sites. We're located in Kershaw, Sumter, Camden, Lugoff, McBee, Jefferson, and Ruby. You can go to our website, www.sandhillsmedical.org, and get information on each site. We are accepting new patients. We provide primary care services, And we also provide HIV care services, but we only do that at our Sumter, Lugoff, and Jefferson location. Oasis Care, that's my department. Opportunity AIDS Service Intervention and Support. That's the acronym of what Oasis stands for. We provide free HIV testing. You can get your results in just 20 minutes. Because of the pandemic, we're only doing HIV testing by appointments only. But we are here to serve you. So if you call us up, say you want to get tested, we will test you at each of our locations. HIV clients, we are here meeting the needs of individuals living with HIV. That's our overall goal for the Oasis Care Department. Again, I am Patrice Robinson. You can call me if you have any questions. I know this is a video, so you can't ask questions now, but you can call me. My contact information is on the screen. You can email me, and I will definitely answer any questions that you may have. And if I don't know the answer, guess what? I'll research and find it. The statistics that I share with you today, I got the information from South Carolina DHEC and also the Center for Disease Control. Saraz, thank you so much for the opportunity to speak with you for World AIDS Day. It is such a pleasure. I enjoy educating my community one presentation at a time. I pray that I said something to you that you can use and share with others. Thank you so much and for the opportunity, and I am grateful. Be great, Saraz.